Adoption, and you know, I'm really glad to see that that's now part of the reproductive health and rights and choice conversation. You know, ironically, I think it was the HIV epidemic that first made the adoption industry consider the possibility that LGBT people might be considered candidates for the placement of children. It took AIDS to overpower the age-old toxic misapprehension that all gay men are pedophiles, that LGBT people are thwarted, twisted perverts seeking to molest and recruit children, and that children just generally aren't safe with us. But during the dark days of the 80s, that era of the crack epidemic, of border babies left in hospitals, often HIV positive, gay men were suddenly the people adoption professionals thought might be willing to take on a baby infected with a transmissible illness, a baby that would require intensive care, a baby not expected to live for very long. If there ever could be such a thing as a silver lining in a pandemic, the opening of the door to considering LGBT people as competent candidates to adopt children might have to be it. Now again, many years later, informed by our own grown kids, open adoption has become the overwhelming, acknowledged best practice, whether children are adopted privately, through the foster care system, or even internationally. And our own work going forward will include a focus on addressing root causes that prompt women to relinquish their children. We need to look at the politics and policies surrounding circumstances of women's reproductive lives in countries where we go to adopt, as well as the circumstances of birth mothers here, and think about how race and economic oppression and female subservience conspire to create available babies. This is really painful, but we are responsible for our choices in our community, and they should be conscious ones. Our joy at creating families and giving children comfortable homes requires us to understand the oppressive systems operating against women who bring those babies to us. So, LGBT people are really grateful for all the options we have now to become parents. I don't want to discount that. I have the complication of living and working outside the world of policy and theory and being in daily dialogue with real people struggling to make a miracle, to access the profoundly joyful role of parenthood with the help of reproductive technologies. And that is great. I get to be in touch with the magic and the miracle of it. But I also see the perils implicit here, and I very much welcome the opportunity to do better at creating our families, to do that consciously, ethically, morally, with eyes wide open and awareness of the implications that go way beyond our own households, to an understanding that our abundant choices contain implications for the deselection of whole communities, of the disabled, the female, the queer, among them. So, if any of you feel, if you're on this path and you need support in this path, please come to our support groups that we offer at the center. We have a half a dozen of them for bioparenting for women, bioparenting for men, co-parenting projects. You know, men and women want to meet and make babies and raise them together, even though you're not intimate sexual partners. Adoption and foster care. There's a lot of choices there, and I hope you'll come and join us. What has come out of all of this I just described to you is a project we call Causes in Common, Reproductive Justice and LGBT Liberation, because the center was formed in 1983, and not long after that, it was contacted by NOW, National Organization for Women, because NOW wanted us to endorse a pro-choice platform in advance of the 1989 March for Women's Lives. And the center board voted unanimously, and this is not typical of our board, that's very apolitical, voted unanimously to take, it was this and the death penalty, that's what they said. They voted unanimously to take a pro-choice public position. And now, and then 15 years later, when Richard Burns, who was then our executive director, and the leading LGBT activist, many of you may know, Urvashi Vad, who was then at the Ford Foundation, they're good friends, and they were talking about how frustrating it was that progressive change movements tended to do their work separately with little contact, let alone coordination. So back at the center, I was daily taking these calls and listening to the issue of reproductive choice, the lack of it around lack of access to care, with cultural incompetence as an issue, bias barriers, economic inequities, and just generally turning the issue of choice on its ear by making the discussion not being about straight women's right to an abortion, but a queer person's right to have a family. So we were doing it sort of on the service end. We were sort of the living laboratory, and Richard and Urvashi, and soon a woman named Carmen Vasquez, who was our public policy director at the time, they they sort of served as the theorists and the think tank, and the Ford Foundation funded us, and with we've come up with a document that describes the intersections between reproductive justice work and LGBT liberation work, and how we really are the shared target in the rights, the far rights. We're the bullseye in the middle, and we tended to work quite separately. So the idea is, when you're talking about abstinence-only sex ed, or you're talking about parental notification laws, or emergency contraception, or whatever the issues may be, that we really we share the work. We should share strategies and resources, and at least talk to one another. So that's the idea behind Causes in Common. There's literature about it in the back. A lot has changed since we wrote that in 2003. Young activists, really folks like you guys primarily, and often women of color, have worked to shift the conversation and the concentration from the perspective of choice to a much broader, more comprehensive understanding of the issue that includes access to health care, economic and racial justice, emerging out of a history of injustices, including eugenics practices, and that requires a critique of the ethics of assisted reproductive technologies, a broader definition of and understanding what a family is, and much more. So now we're a coalition of about 140 organizations, something more than that. It's been 6 years, and we're working on evolving that and identifying the work going forward. The coalition is built, and in fact, there's a certain kind of success on, I think we might have actually done it. We might be done. We made a lot of, we created forums for introductions, and people who didn't know each other now do. And they've almost forgotten how they even initially met. Their work is, their acquaintance is deep, and their shared work is, they're close colleagues, and the work is getting done across the country. So anyway, that's what came out of it on a policy level, and I hope any of you guys who might represent organizations who might wish to be coalition partners should pick up literature in the back. But that's how the policy